There is a county in Ohio where cancer rates are 60% of the state average. 60%. Not because of some experimental gene therapy funded by a $4 billion government contract. Not because of a breakthrough pharmaceutical that costs $900 a month. Because of plants. Plants growing in kitchen gardens behind white clapboard houses, in the ditches along gravel roads where buggies still outnumber pickup trucks, in window boxes next to jars of pickled beets. The people who live there are Old Order Amish in Holmes County, the largest Amish settlement in the world, and they have been growing these plants for over 400 years. And the pharmaceutical industry, which pulled in $1.4 trillion in global revenue in 2022 and cannot patent a single one of these plants, would very much prefer you never learn their names. I'm going to give you all 15 today. 15 Amish healing plants backed by real clinical research from named universities, used in communities from Lancaster County, Pennsylvania, to Holmes County, Ohio, to Elkhart County, Indiana. Two of these, numbers 7 and 12, completely change the way I think about what belongs in a medicine cabinet. Number 1, elderberry. The Amish call it nature's pharmacy, and they are not exaggerating. In Lancaster County, specifically in the Gordonville and Intercourse communities, elderberry syrup is one of the first things a grandmother reaches for when a child gets a cold. They harvest the dark purple berries in late August, boil them down with raw honey and cinnamon, and bottle the syrup in mason jars that line the cellar shelves by September. But here is what the pharmaceutical industry will never tell you. In 2004, a randomized controlled trial led by researchers at the University of Oslo and published in the Journal of International Medical Research showed elderberry extract relieved flu symptoms 4 full days earlier than a placebo. 4 days. A follow-up study by Professor Mumkwoglu at Hadassah University in Israel confirmed antiviral properties against 10 strains of influenza. The global herbal supplement market is worth over $60 billion, and elderberry is one of its fastest growing segments. You cannot patent a berry. That is the problem. A single elderberry bush produces between 12 and 15 pounds of berries per year once mature. One bush provides enough syrup for an entire family through winter. The Amish plant them along fence lines where they require no maintenance, no irrigation, and no fertilizer. They fruit reliably in zones 3 through 9. The bushes live for decades. Generations of Amish families have harvested from the same plants their grandparents put in the ground. Free medicine that comes back every August without being asked. Number 2, echinacea. Before European settlers ever crossed the Atlantic, indigenous North American peoples were using echinacea for snake bites, toothaches, and infections. The Amish adopted it centuries ago. Walk into almost any Amish pantry in the Arthur, Illinois settlement, and you will find dried echinacea root stored alongside the canning supplies. They brew it into tea at the first sign of a scratchy throat. A 2014 meta-analysis by Professor Craig Coleman at the University of Connecticut reviewed 14 clinical trials and found echinacea reduced the duration of upper respiratory infections by an average of 1.4 days. It is not a miracle cure. The Amish never claimed it was. They call it common sense. Number 3, yarrow. If you have ever cut yourself badly while working in a field, you understand why the Amish keep yarrow tincture in their pantries. Its Latin name, Achillea millefolium, references Achilles. In Holmes County, Ohio, families harvest yarrow from garden borders every July, hanging it to dry in barn lofts before preparing tinctures for bleeding and fever. Research published in Phytotherapy Research in 2017 confirmed yarrow's antibacterial and anti-inflammatory properties, with particular efficacy against Staphylococcus aureus. It clots wounds, it brings down fevers, it grows in your backyard, and it costs nothing. The Amish prepare yarrow 2 ways. For wound care, they crush fresh leaves into a poultice and press it directly against a bleeding cut. The tannins constrict blood vessels, and the volatile oils prevent infection simultaneously. For fevers, they steep dried yarrow flowers in boiling water for 10 minutes and drink the tea hot, which induces sweating that naturally brings body temperature down. During flu season in Holmes County, yarrow tea is as common as coffee. The plant spreads aggressively in most gardens, which the Amish consider a feature, not a problem. The more it spreads, the more medicine you have. Number 4, plantain. Not the banana, the broad-leafed plant you have been mowing over your entire life. During harvest season in Lancaster County, Amish workers chew plantain leaves and apply them directly to bee stings. No EpiPen, no emergency room visit, no $400 bill, just a a leaf. Studies in the Journal of Ethnopharmacology confirmed plantain's anti-inflammatory and antimicrobial effects. It contains aucubin, a compound shown to protect against oxidative stress. A 2016 study at the University of Coimbra in Portugal demonstrated anti-inflammatory activity comparable to diclofenac. The plant also contains allantoin, the same compound found in expensive cosmetic creams marketed for skin regeneration. Amish mothers in Holmes County crush fresh plantain leaves into a paste and apply it to scrapes, insect bites, and minor burns on children. They call it the Band-Aid plant. It draws out infection, reduces swelling, and promotes tissue repair. It grows in every crack in every sidewalk in America, and most people poison it with herbicides. The Amish figured this out without a single clinical trial. Number 5. Comfrey. This one makes modern doctors nervous, and that tells you something. Comfrey has been used in Amish communities for centuries to heal wounds, reduce swelling, and mend bones. They call it knit bone for a reason. The German Commission E approved topical comfrey for blunt injuries. A 2010 study in phytomedicine by researchers at Merck Selbst Medication found comfrey root extract more effective than a standard topical anti-inflammatory for ankle sprains. The topical anti-inflammatory market generates over $2.3 billion annually. The Amish use a garden plant. They harvest comfrey leaves and roots from dedicated patches in their gardens, chop them fine, and mix them with lard or beeswax to make poultices that they wrap around sprained ankles, bruised ribs, and sore joints. Amish farmers in Elkhart County apply comfrey poultices after long days of physical labor. The allantoin in comfrey stimulates cell proliferation, literally accelerating tissue repair at the cellular level. Modern medicine banned internal use of comfrey due to pyrrolizidine alkaloid concerns, but topical application remains approved across Europe, and the Amish have been using it topically for 400 years without incident. The plant grows back aggressively after every harvest. It is practically impossible to kill, free medicine that refuses to stop growing. And this is where it gets really interesting. Number 6. Calendula, the medieval warflower. Calendula was pressed into battlefield wounds during the Civil War and has been cultivated in Pennsylvania Dutch herb gardens since the 1700s. In the older Lancaster County settlements around Bird in Hand, Amish women steep calendula petals into olive oil for 6 weeks, then blend with beeswax to create salves for burns and rashes. A 2004 trial led by Dr. Pommier at the Grenoble Teaching Hospital found calendula ointment significantly reduced radiation dermatitis in breast cancer patients. 254 patients. A flower outperformed standard care. You will not see that on a television commercial. Number 7. Chamomile. This is the one that completely changed how I think about sleep. I personally had been relying on melatonin for years before I learned this. Every Amish household keeps chamomile tea on hand. It is not a luxury, it is infrastructure. In Elkhart County, Indiana, communities around Shipshawana grow German chamomile and dry the flowers in their attics. A 2016 meta-analysis in phytomedicine found chamomile significantly improved sleep quality. Another study in the Journal of Clinical Psychopharmacology by Dr. Keefe at the University of Pennsylvania showed it reduced generalized anxiety disorder symptoms by over 50%. The Amish drink it before bed the way most Americans take a sleeping pill, except chamomile does not come with a black box warning. The prescription sleep aid market generates over $5 billion annually. Number 8. Lavender. In Elkhart County, Indiana, Amish women tuck lavender sachets into pillowcases and linen drawers. It is not just tradition. A 2012 randomized trial at King's College London found inhaled lavender oil reduced anxiety scores in patients awaiting dental procedures. Another study by Professor Casper at the University of Vienna showed lavender capsules were as effective as lorazepam for generalized anxiety, as effective as a benzodiazepine. Let that sink in. The benzodiazepine market generates over $3 billion annually. Number 9. Peppermint. The Amish grow peppermint in abundance, particularly in the moist bottomlands of Holmes County, Ohio. They use it for headaches, nausea, and digestive complaints. They brew it fresh, not from a plastic-wrapped tea bag manufactured in a factory. A 2017 meta-analysis of 12 randomized controlled trials found peppermint oil capsules significantly improved irritable bowel syndrome symptoms, reducing abdominal pain by an average of 30%. The Amish have been drinking peppermint tea for gut trouble for 400 years. A separate study in the British Medical Journal found peppermint oil reduced colonic spasms during colonoscopy procedures, suggesting direct, smooth muscle relaxation in the gastrointestinal tract. The Amish preparation is simple. They pick fresh leaves, bruise them between their fingers to release the oils, pour boiling water over a handful, and steep for 7 to 10 minutes. No tea bag, no processing facility, no packaging, just leaves and hot water. Some families also apply crushed peppermint leaves to the temples for tension headaches. The menthol creates a cooling sensation that activates kappa opioid receptors in the skin, providing genuine analgesic effects through a mechanism the pharmaceutical industry understands perfectly well, but would rather you did not. Modern science just confirmed what Lancaster County grandmothers have known for generations. Number 10. Valerian. If you have trouble sleeping and your doctor reaches for a prescription pad, ask yourself why nobody mentioned valerian root. Amish communities throughout Lancaster County harvest the pungent roots in autumn and dry them in cool attics. A 2006 study in pharmacopsychiatry by researchers at the Foelinga Health Center in Sweden found valerian improved sleep quality without the morning grogginess of pharmaceutical alternatives. It grows in temperate climates across zones 3 through 9. The Amish prepare valerian by drying the roots, grinding them into powder, and steeping the powder in hot water for 15 minutes. The smell is powerful, almost unpleasant, but the effect is unmistakable. Valerian increases gamma-aminobutyric acid levels in the brain, the same neurotransmitter pathway that benzodiazepines target. The difference is that valerian does it gently, without the addiction risk, without the cognitive impairment, and without the withdrawal syndrome that makes benzodiazepines one of the hardest classes of drugs to stop taking. The prescription sleep aid market generates over $5 billion annually. Valerian root costs about $8 a pound dried and lasts most families an entire winter. But stay with me because what comes next changes everything. Number 11. St. John's wort. This bright yellow flower grows wild along roadsides in Pennsylvania Dutch country. The Amish have used it for centuries as a mood lifter and nerve tonic. A 2008 Cochrane review led by Dr. Klaus Lind at the Technical University of Munich, analyzing 29 clinical trials with over 5,000 patients, concluded St. John's wort was as effective as standard antidepressants for mild to moderate depression, with fewer side effects. As effective as SSR is, fewer side effects. The antidepressant market generates over $15 billion annually. Eli Lilly spent $1.2 billion marketing Prozac at its peak. You connect the dots. Number 12. Goldenseal. Native to the Appalachian woodlands, goldenseal is one of the most prized plants in Amish folk medicine. They use it for infections, digestive issues, and as a general immune booster. Its active compound, berberine, has been the subject of over 5,000 published studies. A 2014 meta-analysis in the Journal of Ethnopharmacology showed berberine demonstrated blood sugar regulating properties comparable to metformin. This single compound could challenge multiple pharmaceutical categories, and it grows in the forest. I personally think this is the most underrated compound in all of natural medicine. Number 13. Black cohosh. Amish women in Lancaster County have used black cohosh for menstrual cramps and menopausal symptoms for generations. This is part of the Braucherei tradition, the Pennsylvania Dutch powwow healing system dating back to the 1700s. A German clinical trial at the University of Göttingen found black cohosh extract comparable to hormone replacement therapy for hot flashes, comparable to HRT, without the associated breast cancer risk that led to the Women's Health Initiative trial being halted early in 2002, when researchers discovered that the combination of estrogen and progestin increased breast cancer risk by 26%. That trial involved over 16,000 women. It was stopped for safety reasons. Yet hormone replacement therapy remains a multi-billion-dollar industry. Black cohosh grows wild in the Appalachian forests that border many Amish communities. The Amish harvest the roots in autumn after the plant has gone dormant, dry them, and prepare tinctures that women use throughout menopause. No prescription, no cancer risk, no monthly pharmacy bill. The hormone replacement therapy market generates over $3.7 billion annually. And here's the part that should make you angry. Number 14. Mullein. You have seen this plant 1,000 times. Tall, fuzzy-leafed, growing in every neglected lot in America. The Amish smoke dried mullein leaves for respiratory congestion and brew mullein flower oil for earaches. Research has confirmed mullein's expectorant and anti-inflammatory properties. This plant is everywhere. It is free. It works. And 36% of Amish women report using herbal medicine regularly according to a study published on Science Direct. They are not fringe. They are a community with cancer rates 60% of the Ohio average and asthma asthma rates 4 to 6 times lower than comparable populations, according to the New England Journal of Medicine. The pharmaceutical industry spent $372 million on lobbying in 2022. Something is working, and they do not want you to figure out what. Amish preparation of mullein is straightforward. For respiratory congestion, they dry the large fuzzy leaves, crumble them, and either smoke them in a pipe or steep them into a strong tea. For earaches, they infuse mullein flowers in warm olive oil for 2 weeks, strain the oil, and drop it into the affected ear. This mullein flower oil is one of the most common remedies in Amish medicine cabinets across Pennsylvania and Ohio. It soothes inflammation and has mild analgesic properties. The ear infection treatment market generates over $2 billion annually. The Amish use a flower soaked in olive oil. Number 15. Garlic. The Amish do not use garlic as a garnish. They use it as medicine. Raw cloves crushed and left to sit for 10 minutes to activate allicin, then eaten straight. Garlic poultices applied to the chest for congestion. In Lancaster County, garlic is planted in October and harvested the following July, then braided for root cellar storage. Over 33 randomized controlled trials have studied garlic's cardiovascular benefits. A 2012 meta-analysis at the University of Adelaide found it lowers systolic blood pressure by an average of 8.6 millimeters of mercury. It reduces cholesterol. It has broad-spectrum antimicrobial activity. The Amish eat it raw, by the clove, the same way their great-great-grandparents did in the 1720s. And here is the detail most people miss about garlic. The allicin only forms when fresh garlic is crushed or chopped and exposed to air for 10 minutes. Swallowing a whole garlic clove does almost nothing medicinally. Cooking garlic above 140 degrees destroys the enzyme alliinase that produces allicin. Every garlic supplement in capsule form, every roasted garlic recipe, every pre-minced jar of garlic in the refrigerator section has diminished or zero allicin activity. The only way to get the full medicinal benefit is the Amish way. Crush it, wait 10 minutes, eat it raw, it burns, it works.